Veterinary medicine is a messy business both physically and emotionally. Explaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
Part 2 of Wellness Blood Work. We are going to discuss chemistry panels today, and chemistries are mostly run on serum, which is the amber-colored protein-rich liquid that is left when the blood clots, and then the red blood cells, white blood cells, and platelets are kind of spun down or spun out. And the serum biochemistry profile, also called the chemistry profile, contains different panels, so different numbers of tests. And in the wellness blood work, there's usually a larger number of tests that help us to screen all body systems. And the blood work can also be used to monitor chronic diseases, especially when we monitor chronic diseases, we tend to actually run more limited testing because we're looking for very specific indicators for very specific organs. And the body systems and categories that we are going to talk about with the chemistry panels are glucose, which is your blood sugar, your kidneys, your liver, your gut and pancreas, which we kind of clump together, proteins, muscles, electrolytes, calcium, and phosphorus. But first, let's talk about the artifacts. So there's two primary artifacts or issues that can affect the results of the blood work. Hemolysis, which is the breakdown of red blood cells, and that usually occurs either when you're drawing the blood. So if we say it was a clean stick, that means that the needle was inserted through the skin into the vessel and the blood was drawn quickly, no issues, didn't take a long time, bam. If it was not a clean stick, that is either user error, so we screwed up and or we're having an off day when drawing blood, or the patient was a little crazy pants. So little dogs that kind of like jump around, or even big dogs that think that they're actually bucking broncos, or cats that are real bad and have a very strong opinion about you drawing their blood, can all affect how easily the blood goes from the vein into the needle. And then also you can cause hemolysis when you are putting the blood into the syringe or the collection, when you're putting blood from the syringe into the collection tube. And I personally think that we can reduce hemolysis by, instead of, like, you have a collection tube, which is basically a little plastic clear tube that then has a rubber stopper. And so some people will put the needle through the rubber stopper and then let the negative pressure that's in the tube suck in the blood. And I think that that can increase hemolysis. So I actually have, if we use a needle and syringe to draw the blood, I have them cap the needle, remove it, and then you take the stopper out and then you squirt the blood into the tube that way, because I think it limits some of the hemolysis. Now, there are things called vacutainers, which are basically, that's primarily what they use in human medicine. So they'll either use a straight vacutainer or a butterfly vacutainer, and that is basically something that has a needle on both sides. So and then directly into the tube. The second potential artifact is lipemia, and that is increased fat cells within the blood. And it gives the blood this visible kind of white tint when you spin it down. And with hemolysis, it gives it a red tint when you spin it down. And then if they have both hemolysis and lipemia, it honestly looks like a strawberry milkshake. It's kind of gross and interesting at the same time. And lipemia, we can see it if they've just eaten. Certain animals with specific diseases can have it. Schnauzers, Shelties almost always have lipemia because a lot of times they have issues with their triglycerides and their cholesterol. But both hemolysis and lipemia can actually cause increases and decreases to specific values within the chemistry. And they usually grade the level of hemolysis and lipemia. So it gives you an indicator when you get the blood back from the lab, and like an N is normal, so there is none. And then there's a 1+ to a 4+. And 4+ is usually, hey, something's going to be screwy because of this artifact. Now we're going to go through the different categories that I mentioned kind of at the beginning. So first we're going to start with blood glucose. And glucose is a simple sugar that's used by the entire body for energy, but it needs insulin to push it into the cells so that the glucose can be utilized as an energy source. Glucose just floating around in your blood does not do you any good. You actually have to be able to have it go into your cells so it then can actually be of use. So diabetics have tons of sugar, right? So their glucose is usually really high. And that's the irony, right? Is you have too much sugar because you don't have enough insulin to actually push it into the cells so that your body can use it. And it's really like the mammalian version of water everywhere and not a drop to drink, right? So glucose everywhere, but I can't use it. Diabetes, as we just talked about, causes high blood sugar or hyperglycemia, because remember, we always have to have fancy names for everything. And other causes for hyperglycemia are after eating. You will usually have a mild increase for up to about 2 hours after eating. Stress, especially in cats, can cause a rapid and sometimes very pronounced high blood sugar. Certain drugs, including steroids, some diuretics, and some estrogen supplements. Head trauma, weirdly enough, can cause hyperglycemia. And decreases in blood sugar called hypoglycemia. So lab error is one of the most common. And what happens is when you draw the blood and you put it in the tube, it's supposed to clot for like around 15 minutes, no more than 30. And if you don't then put it in the centrifuge and spin it down, right, to separate out those red cells, white cells, platelets, to give you that serum, then the red cells are still going to be hungry and they're kind of floating around. And so they're going to nom on the glucose and they're going to make it look artificially low. So if we have an animal that's totally healthy and we send the blood off and we get back a low blood sugar and everything else is perfectly normal, 9 times out of 10, it's because we forgot to spin the blood down in time. So usually I'll just have them come back and do like a no charge blood sugar check with our little in-house glucometer, which is just like a spot reader, similar to what we use in people, but we actually use a different machine and different test strips compared to people. And if it's normal, cool, then it was our bad and we move on. If it's abnormal, then we got to talk about potential other causes, which include insulin-secreting pancreatic tumors. So there's different types of pancreatic tumors, and one of which they can actually cause high levels of insulin throughout the body, which results in a chronic or prolonged hypoglycemic state. Starvation is another potential cause. Addison's disease, which is also known as hypoadrenocorticism. And Addison's disease, the long and the short is your adrenal glands, which are like these little triangular shaped blobs above your kidneys, and they secrete a lot of different things, one of which is cortisol or stress hormone. And in hypoadrenocorticism, you do not have well-functioning or at all functioning adrenal glands, and so you do not have stress cortisol that gets secreted. And so in times of stress, what would usually happen is your cortisol would get released, and cortisol inhibits insulin, and your blood sugar would go up. But if you have Addison's, then your body like never really recognizes when it's stressed out, and so you can actually get a low blood sugar from that. Shock can also cause it. Some liver tumors that actually produce other hormones that affect blood sugar can cause it, and then some types of liver disease. Usually that's end liver disease and or pretty significant cirrhosis. So now we're going to look at the kidneys. So there's 3 main values that we look at for kidneys. There's the creatinine, the BUN, which some people call BUN, and SDMA. So the creatinine is a chemical waste product from muscle metabolism, and it's filtered by the kidneys. So it is a normal chemical in the body, and the kidneys are supposed to get rid of it. So if you see increases in creatinine in the blood, that means that the kidneys are not doing their jobs. And it, in a way, is an estimate of what's called GFR, glomerular filtration rate, which is the gold standard to measure how well the kidney is functioning. High creatinine means that the GFR is not good, but it doesn't really tell us how not good. The downside of creatinine is 75% of the kidney has to be destroyed before you're going to see the serum creatinine rise. So that means that by the time that creatinine starts to go up, you've already got a fair amount of kidney damage. So aside from kidney disease, other causes of high creatinine are breed variations. So very, very muscular dogs like greyhounds can sometimes have a normally high creatinine because remember, it's a waste product of muscle metabolism. So the more muscle you have, the more waste product you're going to have, and that can actually affect the creatinine. You can also see high protein diets cause it for a similar reason. Low creatinine tends to be due to muscle loss or wasting, and then really, really young patients. The BUN is a normal waste product produced by the liver after you eat, and it's also filtered by the kidneys. And it starts to increase in kidney disease again when there's 75% of the kidney function is destroyed. So ideally, you'd like to catch it earlier. There are other causes for the BUN to be elevated. Dehydration is a really big one. Also, blood loss in the gut is another one. You can also see what we call post-obstructive. So like if you can't pee, you can see the BUN and the creatinine go up in those cases. Low BUN it tends not to be clinically significant. However, if you suspect like end-stage liver failure, you can actually see the BUN start to drop at that point because the BUN has to be produced by the liver, right? So if the liver's not functioning, you're not going to have it. BUN and creatinine together, plus the urine concentration, which we'll talk about more when we do urinalyses, that does give you an idea about the health and function of the kidney. But there's a new test called SDMA, which is a methylated form of arginine, which is an amino acid that's found within the protein cells of all vertebrates, and it's excreted by the kidneys. SDMA has been found to be more closely correlated with GFR than creatinine, and its increase actually occurs a lot earlier in kidney disease. So only 25% of the kidney function needs to be destroyed before you're going to see changes in SDMA. I think it's a great test. I personally think that it's actually affected by hydration status and or like sometimes phase of the moon, because sometimes you'll get animals with like totally normal creatinine and BUN, totally normal urine concentration, and like a fluke elevation in the SDMA. And then you check it a month or so later and it's totally normal. And I think that we're still learning about it. I think that it is a good diagnostic tool. I just think it's not something that you can hang your hat on and say just because it's elevated, the patient has kidney disease. There are other factors and values that we look at when evaluating kidney health. Things like potassium, which a poorly functioning kidney is going to like spill out, literally pee out potassium. Sodium tends to creep up because you get increased loss of water through the kidneys. So you tend to have chronic dehydration, which will lead to higher sodium levels. Your phosphorus is normally excreted by the kidneys. So if they're not working, your serum or your blood phosphorus tends to creep up. Same thing happens with calcium. And if your calcium and your phosphorus are both high and they're high enough, so if you take your calcium value times your phosphorus value, and if it's greater than 60, then that is actually the point at which you will start to mineralize. And what that means is that there's enough calcium and phosphorus floating around in your blood that you're going to start to make these little tiny pinpoint areas of calcification throughout the body. And depending on where you calcify, it may or may not be a big deal, but if it happens in the heart, like that can be a pretty big deal. The last one we look at is albumin, and there are certain types of kidney disease that can actually affect one portion of the kidney called the glomerulus, and that can basically poke big holes. So your kidney is just a giant sieve, and if you have big holes poked in the glomerulus, which is like the ball portion of the kidney, when you look at it on the cellular level, then you can allow the leakage of larger molecules like albumin. And we'll talk about albumin in a little bit, but it can cause a whole lot of issues if it's low. On to liver. Alanine transaminase, or ALT, and alkaline phosphatase, or ALP, which I was actually taught to abbreviate ALKP, but it seems like everybody abbreviates it ALP. Anyway, those are your two main liver enzymes. And your ALT is an enzyme that's present in large quantity in liver cells. And it's a sensitive indicator of liver damage. So if there's high levels of ALT in the blood, that means that there's damage to liver cells because the liver cells break open or wither and ALT is released into the blood. So you can see it because of actual liver disease. Some toxins can cause it, certain drugs like anti-inflammatories, phenobarbital, which is an anticonvulsant, and steroids, and then trauma can actually, like blunt force trauma to the abdomen, so our hit by cars can have elevated ALT that's transient and it does resolve. Decreases in ALT are really not significant, but again, if we think it's severe liver failure or cirrhosis, we can sometimes see it. The ALP is another enzyme that's present in liver and bone, and serum elevations of ALP occur if there is what's called bile stasis in the liver. And you can also see it if you have really rapidly growing bones, like in puppies and kittens. Your bile is this liquid that helps with digestion, and it's created by the liver and then stored in the gallbladder. And if there is what's called bile stasis, right, so decreased flow of bile, then you're going to get elevations of the ALP. So cholestatic liver disease, which is just a fancy way of saying like a disease of the liver that affects the formation of bile, as well as the tubes that go from the liver to the gallbladder and then from the gallbladder out into the small intestine. Other potential causes of ALP are steroids, acute pancreatitis, fatty liver disease, which we see in cats, passive congestion. So your liver is a giant filter. So if there is increased pressure before the liver in the chest or after the liver in the abdomen, you can sometimes see what's called passive congestion. And that's most commonly seen with right-sided heart failure. And again, puppies and kittens that have super fast growing bones can have elevations in alkaline phosphatase, and that's totally normal. Decreases, just like ALT, not usually significant.